So Dr. Yang is the Chief of Optometry and a Co-Residency Program Coordinator for the VA Palo Alto Healthcare System. Dr. Yang received his optometry degree from the UC Berkeley in 1994 and completed a residency in geriatric and hospital-based optometry at the West LA VA Medical Center in the following year. He holds a clinical faculty appointment of clinical professor from UC Berkeley. He's a fellow of the American Academy of Optometry and is board certified in medical optometry. So he has lots of titles, lots of rank. He has lectured at local, regional, national, international, maybe even the space conferences on multiple topics related to ocular disease and contact lenses. He is a co-chair of the VA National Optometry Contact Lens work group, council member for the Accreditation Council on Optometric Education, ACLE, and a journal reviewer for the Optometry and Vision Science. He is Iron Man. He runs, he bicycles, and I just can't believe how strong he is. And Dr. Li Vian is the co-residency program coordinator, director of optometry clinic operations, director of optometric trainees, and polytrauma optometry program coordinators. Ooh, so many titles too here. He holds clinical faculty appointments of assistant clinical professor from UC Berkeley and clinical assistant professor from SCCO at the Marshall B. Ketchum University. Dr. Vian is a fellow of the American Academy of Optometry and is board certified in medical optometry. He is a journal reviewer for numerous peer-reviewed journals, and he has published many, and a subcommittee chair for the Admittance Fellowship Committee for the Academy. He has lectured at local, regional, and national conferences on multiple topics related to ocular disease, as well as authored multiple publications related to ocular disease and polytrauma. And also, he has a website. He developed and maintains a website to aid eye care providers in interpreting OCT scans. Please welcome Dr. Yang and Dr. Vian.
All right, thanks a lot, Cooney. Make it sound so darn good. Thank you. But yeah, I want to thank all the attendees for being here this evening, learning about our residency programs at the VA Palo Alto Healthcare System, as well as the San Francisco VA. Dr. Veen and I were huge proponents of residency training, really get advanced focused training in a specific area of interest, and it really is a springboard for lifelong learning. And we're really happy to have this opportunity to talk to you about our programs. We're going to start off by just showing you a video that we showed applicants last year when we were doing virtual interviews. So I'm just going to share my screen here. And this video runs about 5 minutes. Hopefully the audio is okay.
The VA Palo Alto healthcare system encompasses many clinics and serves veterans from a large geographic area in Northern California. Our optometry department has 4 primary care optometry clinics and 2 specialty rehabilitation centers, supported by 24 providers, 4 optometry residents, and 11 optometry students. What makes VA Palo Alto unique are our facilities with cutting-edge technology and specialty services. We are the only VA with a blind center and a polytrauma center in the same healthcare system. We also have one of the largest specialty contact lens clinics in the VA system.
What I like the best about this residency is the amazing mentorship and the great relationships we have with our fellow co-residents and other staff doctors. What I also really like about this residency is the specialties of low vision and contact lenses.
love about VA Palo Alto is the strong didactics program. With the numerous journal clubs, core studies, and lectures, you'll be a more competent, confident clinician. In addition, at the Western Blind Rehabilitation Center, you'll be able to provide low vision patients numerous resources and devices to allow them to become more independent.
I chose this residency because of how well-rounded it is, allowing me to work with both brain injury patients and also continuing my training in ocular disease. I've really enjoyed working with the team in the Polytrauma Clinic, collaborating on our care of the patients together.
Residency because we get the opportunity to travel to many different clinics and serve a variety of veteran populations. And I also like all the different people we get to work with, and particularly we get to precept students.
All righty. Get the PowerPoint's up on the screen now, Cooney? Yeah, okay. Yeah, so that was a video we put together last year for our residency programs. And we do have 2 optometry residency programs. So we're going to talk about both of them. We can start off by just telling you a little bit about our VA healthcare system, our various clinics, and then we'll get into each of the programs, and we'll give you the opportunity to ask whatever questions you want about the programs. But the VA Palo Alto healthcare system, again, the 2 programs we have one program in ocular disease, geriatric optometry, and low vision rehab. We have 3 positions in that program. And then we have a separate program that's ocular disease, neurooptometry, brain injury vision rehab, and we have 1 resident for that program. That program probably is more geared towards the neurooptometry part than the rehab part, but we do have rehab there as well. But the VA Palo Alto healthcare system, we have 10 different clinics. We have 3 divisions, and a VA division is basically a larger medical campus. We offer services 24/7. We have inpatients and just offer many different services that you don't necessarily get at the outpatient clinics. So we have 3 divisions. Palo Alto division, which is our main hospital where we do the surgeries. We have the Menlo Park division, which currently houses our blind center. We also have all our rehab programs such as alcohol rehab, drug rehab, homeless rehab. All those things are out at the Menlo Park division. Then we have the Livermore division, which has our nursing home. Then we have 7 CBOCs, which are the community-based outpatient clinics. And those are basically your 8 to 4:30 clinics. We offer more limited services at those sites. And so the VA Palo Alto healthcare system, our patient drawing area, we go north to San Mateo County. We go south, well beyond Monterey County. We pull patients from the Paso Robles area. As you can see, we go west out to the ocean, and east, we go out close to the Nevada border. To cover our healthcare system, we do employ actually 29 optometrists, 19 staff, 10 fee basis. We have 4 optometry residents in the 2 programs. We have 10 students at our 4 different sites. We also have positions for 5 optometry health techs and 5 opticians. And in our healthcare system, we have 4 primary care optometry clinics. Those are located at Palo Alto, San Jose, Livermore, and Monterey. We also have the Western Blind Rehab Center at the Menlo Park Division and the Polytrauma Rehab Center that's located at our Palo Alto Division. And as the video noted, we're the only VA healthcare system in the country that actually has both a blind rehab center and a polytrauma rehab center. There's about 13 blind rehab centers around the country, and basically blind rehab center provides inpatient services for our low vision veterans. And there's a bunch of different programs that Dr. Dean will go into later when we talk more about that program. And then there are 5 polytrauma rehab centers around the country. And the polytrauma rehab center, that's where we care more. It's also inpatient. We care more for the severe TBI patients. So we are also a site for the Polytrauma Transitional Program, as well as the Polytrauma Network site. So our polytrauma residents have exposure to the full range of polytrauma patients from mild TBI to severe TBI. And Dr. Dean, again, will go into more detail on that when we get to that part of the talk. So again, yeah, we have the 4 eye clinics here at the Palo Alto Division. So the Palo Alto Division, we're a standalone optometry clinic. I think I'll get more detail about that in a later slide. Livermore Division is combined eye clinic with ophthalmology. San Jose is a standalone optometry clinic, and Monterey is also a combined eye clinic. We also have the Western Blind Rehab Center and the Polytrauma Rehab Center. Down the road, some of this more soon coming up than others, but the Polytrauma or the Rehab Center is a large facility, and once it's open, it'll be the only VA facility in the country that will actually have a blind rehab center and a polytrauma rehab center in the same facility. So our blind rehab center, our polytrauma rehab center will actually move into that building. So the video noted is expected to open in 2021, but that got pushed back to now early 2022. So we are very hopeful that the blind center will move in likely around January, February of the year, with the polytrauma program moving in a few months after. We are opening up a French Camp Stockton clinic that will take the place of the current Stockton clinic, and it will be a much larger facility. And down the road, we're going to close down the Livermore clinic, and those specialties will move over to the French Camp area. But that, I think we're expecting that around 2023, 2024. And then much further down the road is the Ambulatory Care Center, which will house a new optometry ophthalmology clinic, but that's further down the road as well. Our VA is right now going through $1 billion of renovation, and we're currently in phase 2 of 3. So that the Ambulatory Care Center is in that last phase. So this is our main hospital in Palo Alto, and what you're looking at there is our main hospital building. The optometry clinic is located in the Ambulatory Care Center, which is right next door. And again, the Polytrauma Center is also located in the same facility. But at this site, optometry provides primary eye care. We also do polytrauma, and this is where we also do our medical contact lenses. And then our VA Livermore Division. This is located, if anyone's familiar with Livermore, right across from Wente Vineyards. So as you can see, it's a really nice facility in the Teletubby land. But we provide primary eye care there. we provide low vision rehab outpatient services in our interdisciplinary Victors program. And we also have a Polytrauma Network site at that location as well. And then our San Jose clinic, it's our newest one. It opened up just about 3 years ago. And it's a standalone optometry clinic. And with everything VA, when you have a new building, we have all new equipment as well. So this is a really well equipped clinic. And then the one, again, that's our jewel, hopefully open soon, is the Polytrauma Western Blind Rehab Center. So this is the new facility that's built. We're just waiting for it to open up. Okay, so more about specifically the ocular disease geriatric low vision program. So our curriculum, we combine clinical, didactic, and observational experiences. So our clinical experience, we provide, our reps provide primary eye care at 3 different clinics, at the Palo Alto Clinic, Livermore Clinic, and San Jose Clinic. And the reason that we expose the residents to the different sites is that each of those clinics has a slightly different patient base. So our Livermore Clinic is the one that's located furthest east in our healthcare system. And so we draw patients more from the Central Valley, as well as from the mountains area, Stanislaus National Forest area. And so those patients are older and they have more disease. Palo Alto and San Jose are located in more urban, suburban areas. And then we do have the Polytrauma inpatient, outpatient, but for the low vision curriculum, it's low vision inpatient, outpatient. So you can see right there's an error in the PowerPoint. Oh, well, we'll fix that. And then didactic program. We do didactics every Thursday morning. We'll get into more details about what that entails. And then we have various observational experiences. So as far as the clinical aspect, to a large extent, our low vision programs like 3 mini residencies. The Palo Alto resident puts a PAD, the PAD stands for Palo Alto Division. So that resident spends 5 days a week here at our Palo Alto Division. They provide primary eye care, ocular disease, and they have 2 half days in our medical contact lens clinic, and then also the didactics that every Thursday morning. The WBRC is the Western Blind Rehab Center / low vision. And so in that rotation is where our residents will get the pretty much almost all their low vision experiences in both an inpatient and an outpatient setting. We still have a couple of days of primary care to make sure you don't lose those primary care skills. And then the last rotation is the outreach rotation. That is where you travel more to Livermore 3 days a week. And that's where you can get most of your ocular disease exposure, just again, because the patient base there is more geriatric. The average patient base for a Palo Alto clinic is probably in the 60s to 70s, whereas going out to Livermore, you're looking at the 70s and 80s. So a much older patient base. Again, you can see there's a didactic component that's common for all the residents. I think Dr. Bean's going to talk about low vision services.
Great. So I am at home. I'm not sitting in front of Palo Alto, so I might be interrupted by 2 crazy kids in the background in a bit. So hopefully I hit myself pretty well. But Dr. Yang mentioned, about our VA system, and one of the things is that one of the special thing about our VA system is that we do have a blind center, we do have a polytrauma center, and it's great to see that there's actually a lot of familiar names logged in today. So a lot of our students that rotate through our clinics are definitely logged in. So I'm glad to see you're interested in our programs. But for the low vision program, it's very special. W, can you go next real quick?
Oh, sorry, yep.
Yeah, he's controlling it. Yeah, it's very special. Is that if you think about low vision at a school, this is totally different. Low vision in the VA system is great because there's really no insurance. Once your patient's eligible because of visual impairment and they're low vision, they're eligible for all these services, and plus any device that you think they're eligible for, you can prescribe it. There are no insurance or any restrictions. The biggest thing for us is that our inpatient, we're the only blind center, you think about it, kind of in the West, not only, but in the North California area. But there's 2 blind centers, the Long Beach and us in California. But we draw patients kind of from all over. And our WBRC blind center is the second oldest of all the blind centers. So it's very well established. Pretty much Long Beach mirrored their program after ours. And when you have an inpatient program, we're talking about it's an inpatient program that patients can come in and stay for 6 to 8 weeks, pretty much. And pretty much they're in there for the comprehensive exam. It's not just optometry involvement, but you have all these other specialties, which we'll get to later. The full service of orientation mobility, living skills, manual skills. So it's a huge program that they can come in and get a comprehensive care. But also we have an outpatient program where patients aren't, don't want to come in for 6 to 8 weeks. they can actually get to an outpatient program where you see the patient, pretty much you're seeing the patient, let's say in the primary care setting, you diagnose their ocular disease, you're managing their glaucoma, you're managing their macular degeneration, and you realize that they will benefit from a low vision exam. Then you can actually potentially see them as a low vision provider next in your low vision exam, and then also prescribe all these devices. And the great thing about the VA is that when you prescribe a device, you can just give it to the patient. We actually have a full therapist called BROS, or blind rehab outpatient specialist, that actually will go to the patient's house, very similar to an OT, and do a safety assessment. And whatever you prescribe, like a CCTV or a handheld magnifier, they will bring up to the patient's house and then work with that patient and then give you feedback how they're doing. Yeah, so there's different exams pretty much within the inpatient program versus outpatient program. The outpatient program is like Victor's exam. Those are rotated through our clinics. Know that there's one at Livermore. We have one at the Menlo Park right now. But it's huge. It's a same team approach pretty much, where we're looking at the full low vision aspect. The exams are like an hour and a half. You're spending a lot of time with your patients, trial frame refraction, and you're prescribing whatever device you think is necessary for your patient. So in terms of the interdisciplinary approach, we have BROS, as I mentioned earlier. These are therapists that have a master program, usually in orientation mobility, and they're cross-trained. They call them the walking blind centers because they're cross-trained in all these different areas. Within our actual inpatient program, we have a huge training program for our psychology department also, so it's nursing also, orientation mobility. We take students from San Francisco State, from all over. They come over to our blind center also for training. Living skills, manual skills, we're pretty much trying to give our patient independence again. How do they cook at home? How do they clean at home, safely? So they actually have like mock-up kitchens and they'll cook meals for you also. Manual skills, how to fix things at home. They have like a mock-up toilet. How do you fix a broken toilet if you have visual impairment? How do you fix a doorknob? So, and then we have a lot of woodworking also for our patients too. Visual skills, you're prescribing magnifiers for your patient. These patients are getting the rehab and the therapy during that time. So when these patients come in, it's great because it's a blind center. So when you're walking in, you can see your patient working with one of the therapists. They might stop you to ask you a question, or you might ask them how they're doing. So there's a lot of feedback all the time. Next slide. Yeah, so for the inpatient program, we have a regular program where they come in for 6 to 8 weeks. It's a full orientation. But within that, we also have a lot of separate programs, and the VA is really adapting technology. Some of our patients come in for an eye program where they actually will come in and get an iPhone 13 Pro, or they get a brand new iPad. And there's all these specialty softwares they learn how to use. There's a GPS program. So really the VA has adopted a lot of these new devices. And the great thing is that being part of our VA, especially in our location, we have a lot of new vendors coming in. We're working with the Iris Vision, the Orb Cam, and we're actually getting involved in the study with the Iris Vision also at our VA. Now, do you want to take over with the observations or make you going? You're mute. You're mute. Dr. Yang, you're mute.
Yep, thank you. I could probably go on. We should probably hustle up a little because I agree. Time it is. I'll say that our low vision residents also do have a rotate through other specialty areas for observations. They observe our plastic surgeon with an ocularist in our periorbital clinic. They observe our general medicine clinic, which is a primary care providers. They observe in the geriatric clinic, and as well as various observations at the blind center. So that's our low vision program in a nutshell. We'll go quickly to our polytrauma program. So this is the ocular disease, neurooptometry, brain injury, vision rehab. And really the emphasis in our polytrauma part is honestly more geared towards the neurooptometry ocular disease part, more so than brain injury, vision rehab. But if residents have a strong interest in the vision rehab part, we can always increase their exposure in that area. But similarly to the low vision program, so here's where we messed up the slide. This should be the polytrauma. But we have the clinical aspects at the Palo Livermore Clinic. We have polytrauma, brain injury, vision rehab, inpatient, outpatient. The medical contact lens is actually in the low vision program, not this one, so we screwed up the slides. But again, didactics every Thursday morning and their various observational experiences. The brain injury vision rehab residents, there's just one of them, so they don't rotate every 4 months. It's the same schedule throughout. So as you can see, there's several days, 3 days of primary ocular disease, 1.5 days a week of polytrauma. So this program is 60% primary ocular disease, 30% polytrauma, 10% didactics. And then you want to talk about Polytrauma Network of Care, System of Care?
Yeah, so Dr. Yang kind of mentioned already that there's not a lot of polytrauma centers, and we're very unique. Is that we're one of the five, and we get patients from all over. So these are acute TBI patients, and you don't see anything like this in other facilities because this is an inpatient rehab center. So these patients get shipped over from Germany, from Japan, wherever they're stationed at. Once they get stabilized, they come right to us. And it's not just a rehab program because we actually have our neurosurgeons here, and because we're affiliated with Stanford, so they come here for the neurosurgery. So we're actively seeing for their acute care also. We also have a transitional program where we're actually seeing active duty patients a lot of times. So active duty patients will have a TBI or injury, and they'll ship them right to us also for full evaluation. And then our outpatient is our Polytrauma Network site, where they're more mild TBI patients. So it's a full range of patients that you see. Our polytrauma clinic, not only do we have our TBI clinic, but within that we have our comprehensive rehab program, which is our stroke. We're considered a stroke center. So nowhere else would you see a patient with an acute stroke, pretty much seen within our ED, get transferred over to us. So we're seeing patients with they had a stroke like a day or two ago. That's where we're seeing them, and they're inpatient. We're seeing for the full exam. On top of that, we have our SCI, spinal cord injury, is pretty much attached to our current polytrauma building. So we do a lot of bedside exams over in our spinal cord injury. And really often we get called over to our ICU unit also. The unique thing about this is that, we're working with an interdisciplinary team approach. So we get consults from all over, from neurology, neuropsychology, and they see optometry first. We're the gatekeepers. So, if I need to refer to neuro-ophthalmology, I can. But a lot of times we're co-managing with our neurologists a lot of times. Next slide. So again, the polytrauma team is made up of PMR physicians. They have a big Stanford training program there. So we work really closely with them. We work really close to neurology. We have a blind outpatient rehab specialist that does a lot of our vision therapy for us. But if our residents have interest, they can actually do some VT for some of our patients also. Neuropsychology, also, we work closely with them in speech therapy. It's great if you have a patient with aphasia, you can work with a speech pathologist, and then you can see the patient together a lot of times. Okay, next. So Dadian mentioned a lot of this is neurooptometry and neuro-ophthalmology exams. Pretty much we're doing a full ocular assessment for our patients. We see a lot of traumatic cases or ischemic cases. And then on top of that, we're doing a lot of visual assessments. We're looking at, their combination of binocular vision, visual field. We're really trying to figure out, what's going on with the patient and how that impacts their therapies also. But at the same time, we're treating them actively for the disease. And if you think about, TBI and the veteran population, pretty much VA pops right up there. A lot of the original research that came out about veterans and TBIs came from our clinic. So if you look here, just med stuff, you see our VA pop up a lot. So in terms of neuro-ophthalmology and neuro-optometry cases, anything you have read about in the textbook, I've probably seen. Those crazy cases of, traumatic optic neuropathy to traumatic cranial palsies, iNose, gait palsy, skew deviation, pretty much anything you can think of, you probably would experience it at the clinic here. In terms of observations, one of the things we do have is neuropathology observations. So the resident has a chance to work with our neuropathologist and does brain dissections for our veterans. So they work with their pathologists also. But you also observe in primary care, in geriatric, and also our polytrauma center. Dr. Yang, you're mute.
Of course, I'm so good with technology. So yeah, real brief then about our education series. So this is what we do every Thursday morning. We have a case discussion that Dr. Vian leads on interesting cases that he's seen. So kind of like a slide quiz for the residents. Then we have core studies, which is a specific type of journal club. It's led by the mentors, where we read these seminal studies that really defined our standard of care. Some of those studies are probably older than you guys. But it's really helpful to understand those, to really understand the treatments that we do today. Then we have a journal club that's led by the residents. So the residents will choose the paper, they will present the paper and discuss the strengths and weaknesses and future directions that comes up from that paper. Once a month, we do a low vision or applied trauma journal club. So if it's a low vision resident leading it, they'll lead a journal discussion on a low vision topic. If it's applied trauma resident, they'll choose applied trauma topic. We also have lectures every week. Significant majority of them are ocular disease topics, but we also do have topics specific for the specialty areas. So when we have our low vision specialist giving the low vision lecture, applied trauma specialist will do applied trauma lecture for the applied trauma resident. So This educational series, all residents from both programs do participate. The only times where we split them apart is when we do didactic lectures that are specific for their specialty area. And then 3 times a year, we do a grand round program where we'll do case discussions. Pre-COVID, there was live patients that we'd be examining. And then so everyone would look at them. We'd do case discussions of those patients. And then our residents would each do a presentation on that particular topic. And traditionally, we do the big 3. We do glaucoma, mac degenerative, and diabetic retinopathy. But in previous years, we've done neuro, we've done anterior seg. I think one year we did polytrauma. So the subjects could vary. And then once a year, we do a roundtable, which is really just an in-depth discussion on a topic that really doesn't have an answer, and we try to come to some consensus, and then we present those findings to our staff.
I just want to add real quick for the grand rounds, for glaucoma grand rounds, every year we invite Dean Flanagan out to talk to us. He gets involved also in seeing some of the patients, and I know he really enjoys it. So
for the scholarly activity part, our residents are expected to submit an original manuscript of publishable quality. It does go through several revisions to make sure that the end result is a really solid paper. Our residents are also required to submit a paper or poster abstract to a major national conference, and generally our residents will submit to the Academy. They also present a poster at our Geriatric Research and Educational Clinical Center Allied Health Symposium. They do have independent study time as well, where they'll work on their various scholarly projects. Let's see, and then the teaching activities, there's both formal ones and informals. The formal ones is common for all the UC Berkeley affiliated programs, where there are 3 case presentations. You also will present a lecture to our GREC department, the geriatric department, at the end of the year with all the co-residents. There's a number of informal teaching activities as well. Our residents will do slide quizzes for the 4th year interns. We noted PAVA there because they usually do it here at Palo Alto, but now we've been taking advantage of the virtual technology and doing it for all our affiliated student programs. There's also case presentations that they'll give to the mentors or co-residents. There's also clinical teaching, 4th year interns here at the various clinics. And then again, the presentation of the roundtable findings to our staff. Requirements for residency completion, it's you got to complete the residency year, present the 3 cases with the UC Berkeley affiliated programs, submit the poster abstract, submit a published quality paper, submit your complete patient log and evals, and pass your final eval. So we'll skip the last slide because they're just more, fun ones. But we can either open up for questions now, Cooney, unless you want to have SF go and open up the questions at the end. It's up to you.
No, let's actually get the questions from the audience about your programs. So any of the students, if you have any questions, you can post on the chat, or you can just simply unmute yourself and ask questions. So this is a small group of people, so I don't think that you have to worry about it.
I can start us with the question. Oh, it's Andrea, you got one?
I have one too, but I can wait.
Okay. All right. So through your presentation, you're sort of talking about all the different interdisciplinary avenues and people you get to work with. How much flexibility is there as a resident to, I guess, not pick and choose, but like throughout your set schedule, work within those other aspects of healthcare?
Maybe I don't quite get the question. So are you talking about customizing it in some degree to
yeah, I guess I'm not expecting like a full customization, but there's mention of working with different specialists and different parts of patient care.
Yeah, within the specialty areas like the blind center and applied trauma center, you will work with all those different specialties. If you have a particular interest in certain areas, just let your mentor know, and we can have you follow them or shadow them.
Yeah.
And so to that degree, there is a bit of flexibility. If you have a particular interest and we can arrange it, we can do that for you.
Yeah. So like a good example is that we have a patient with vestibular issues. So I would have the resident pretty much shadow the PT when working the vestibular issues, or a patient with aphasia and you're trying to like get a VA or get a reliable answer, they'll have the resident work with a speech pathologist to get a better understanding of what's the best way to work with this patient, and then they'll help with during their exam part of it.
Thank you.
Anything else?
All
Hi,
right.
I actually, oh, go ahead.
No, go for it. I'm just, that's
Okay. Sorry, I'm driving right now, but I just had a question. I'm specifically interested in the neuro rehab one and the brain injury one. Where do you normally see those residents get employment after their residency is over, I guess? Like, if you were just to give me like kind of like a quick little list of where you see your residents get employed after their residency training.
Yeah, definitely. So some of our residents have been in ophthalmology practices. Some of them have been strictly hired because of their training to start at like a neuro rehab program within the group practice. One of our residents from last year, she's starting at Johns Hopkins coming up in a few months. She's starting there. So this would definitely a wide range, but definitely able to utilize their training for that. And specifically, like I said, some of them were hired to start up like neuro TBI programs because of the training. We have some that are stay with us at the VA that are now some of our mentors also. So.
Okay, thank you. I was just curious because I know for sure that I'm sure there's some neuro optometrists working in like VAs and everything working with the military. I just didn't know that maybe private practices might be interested in that kind of stuff as well. So thank you.
Yeah, like I said, one of our residents was specifically hired to start a whole program with a huge group practice in Colorado. So yeah, great.
Any other questions? Maybe Andrea, you have a question?
Sure. I think we probably have time for like maybe one more or so. So I guess I can wrap up with my question for you is, thank you for your thorough presentation, by the way. You answered like 90% of our questions that we have here. But in terms of your residents and their opportunities to interact with other healthcare providers, what about ophthalmology? What opportunities are there for residents to interact with the ophthalmology department at the VA?
So the Livermore Clinic is a combined eye clinic, so they actually work in the same clinic with them. So if they need consultation, there's an excellent working relationship with them. They can knock on the door and consult with them and have them look at their patients. Here at Palo Alto, we're physically in a different building, so there's not that opportunity to just knock on their doors. So here we communicate really through and email, so we can ask for consultations. Some of it will depend on time. If you need immediate consultation with a specialist, they're very open to talking with you with regards to the case and helping you as far as when the follow-up should be and so forth. San Jose is a standalone, so they don't have that. At Monterey, it is a combined eye clinic, but the relationship probably is not as close. So I'd imagine consultation there. Dr. Veen could probably answer better because he's worked in that clinic and I have not. But I believe the consultations are there if it's for emergent cases, but not for your general.
Yeah, they'll definitely walk over and look at your patient too. So one of them is an oculoplastics specialist. So she'll definitely come over and take a look at lesions. It's great with technology though, like Dr. Yang mentioned, we are in separate buildings, so it's not easy to just run over with your patient. But with our technology, everything is networked. So I would run like a fundus foot, like I'll do an intersect photograph, I do an intersect OCT, and I pretty much just like have it right there, a message like the cornea specialist, hey, what do you think about this? Do you think you want to get a biopsy on this? And so they reply right back. So.
Great, thank you. And just a follow up for the ophthalmologists, are there like retina specialists, like cornea specialists, and you said oculoplastics as well?
Yeah, so the great thing is our ophthalmology department is affiliated with Stanford, which is just right down the street. So pretty much all of them are Stanford faculty over there also. We do have retina specialists, the Stanford residents and fellows come to our clinics also too, like the VA Palo Alto. So there's every single specialist. We actually got a new neuro-ophthalmologist recently. So pretty much every specialty we have is, if we need an oncology, then we refer to Stanford also.